Hey there, folks. To anyone's listening, Big Rob here. Just a guy over 50, nobody special, just a working class Joe. I wanted to get on here because I hadn't made a video in a while. I haven't found them very therapeutic lately. Been working a lot and trying to satisfy my last contract for a while. But I wanted to get on here and say 2 weeks ago today, I had myself a nice big old stroke. And I wanted to talk about that a little bit because there are a lot of men in this country neglecting their health. And I wanted to kind of go through sort of the signs and symptoms and things that I went through as the evolution of this stroke sort of carried on. So to lay the groundwork for it, I had been sick. A couple weeks ago, I'd been sick for about 3 or 4 days. I picked up something in the emergency room, a little sinus thing. I've been using a lot of over-the-counter medications to deal with that, things like NyQuil, Dayquil, etc., etc. Now, I already have a blood pressure problem, and my blood pressure was relatively under control with a large dose of metoprolol. I wasn't using anything extra, no water pills or ACE inhibitors or ACE receptor blockers, because ACE inhibitors make me cough. So anyway, so just a beta blocker and trying to keep my body as fit and as clean as possible for a late 50s guy. Fast forward to the illness, had been ongoing for about 3 days, and I had gotten up to go to the bathroom like any other middle-aged man does in the middle of the night, 3 o'clock in the morning. Get up, go to the bathroom, come back to my bed, and I realize I've got a headache, and all of a sudden things are swirling. I began to feel numbness in my face, and then down into my chest on the left side, and then down to the left shoulder, and then all the way to the arm. And then before I knew it, probably a second or two into that, my legs wouldn't hold me up. My left leg had given out, and I was unable to bear weight. And so I woke up my lady, who is my lifesaver. I woke her up and told her to call somebody. Something is wrong. And she's like, do you want to go by car or by ambulance? I said, I think you need to call the ambulance. Now, those of you who know me know that I've spent a lot of time in EMS and nursing and healthcare, upwards, I think the last time I counted it, we're over 30 years now. And I don't like to go to the doctor. I don't like to go to the hospital. I don't like to go to the emergency room because I work in emergency rooms. I know how busy they can be. And it sucks to be waiting. Now, on my way out the door, I was unable to lift my left arm, my left leg, and I could not feel the left side of my face. So the Anchorage Fire Department came, and a couple of big old boys with a stair chair got me out of the house. There's 2 flights of steps just right out this door here. They got my 265-pound ass out the door, into an ambulance, started a couple of IVs. I was called as a stroke alert, going into the emergency room. Never thought it'd be me. I was immediately evaluated by the medical doctor there, sent a CT scan. I also spoke with a neurologist on one of those little robot things, you know. Kind of an interesting technology. It puts one neurologist can reach a variety of patients all over the city if they want to. I was given a drug called tenecteplase, clot buster, maximum dosed, and sent to the ICU. Now, about 30 minutes after I got this drug, I started feeling improvements in my face. I was no longer drooping on the left side. I was able to move my tongue. I was able to speak. And I credit the rapid sort of application of that medication with saving me from having a lot of deficits. And so as far as strokes go, yes, I survived. Yes, I had a right-sided stroke resulting in left-sided symptoms. But because of the medication, I really believe I got a fighting chance to live a normal life again. So fast forward, I'm in the ICU. My blood pressure is wildly out of control. I'm in the 230s, 240s, over the 160s. maybe 130s at some point. I was placed on a nicardipine drip. For those of you who don't know what that drug is, it's for lowering blood pressure. It creates volume inside the vasculature so that your blood pressure be lowered. Heart isn't working as hard to kind of keep your blood flowing. It also helps reduce the pressure inside of your brain. Inside of my brain at the time, pressure is very high, and this is a typical response to brain injury. It's a protective mechanism the brain has. But I was conscious, alert, and oriented to everything that was going on around me. I was never placed on a ventilator, thank God. I was never sedated or any of those kinds of things. And the experience I remember about that the most is the excruciating amount of pain on my left side, spasms and things of that nature. So I was well treated at the hospital by the ICU nurses who knew what they were doing. I know they knew what they were doing because I was an ICU nurse for a number of decades. So very professional, very well thought out. I did have an orientee, so I kind of kept an eye on her, mostly because I didn't want her to be afraid of the fact that I'd been a nurse for 3 decades or anything like that. And as a sidebar, typically I don't tell people that I'm a nurse when I'm having a healthcare encounter. Like if I go to the doctor's office or something like that, they don't know that I'm a nurse because I don't want people thinking that I'm gonna, throw my professional weight around or be a professional bully like a lot of nurses are. So just as a sidebar. Anyway, somehow, I moved over to PCU after about 48 hours in the ICU, moved over to PCU, and of course they found out I was a nurse there because one of the nurses who works there also works with me over at ANMC in the ER. And so he's like, oh, hey, I know this guy, da-da-da, 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 and proceeded to tell them all about me. Whatever. He's a good dude. I like him. So he's gonna do great things. I spent a couple days in the PCU getting rehab and slowly trying to improve. Things like getting out of bed were extremely difficult to me. Sitting up is extremely difficult for me. Things like trying to use machines to get up and go to the bathroom. So, it's been very, very difficult. I had some good physical therapists and occupational therapists. They taught me some things, some practices I've been using at the house. And they underscored the concept that the vast majority of your recovery happens in the first 6 to 12 months. Some of the pubs I've been reading say, you make the fastest recovery in the first 3 months, then it sort of slacks off for 6 months and then slacks off into 12 months. But there's no slackers in this house. So anyway, what have I been doing since? Well, I was released about a week ago, and I've been at home, and I don't have any physical or occupational therapy support at home because of insurance issues. So if you get sick in America and you don't have insurance, unless you're an immigrant or you're dead ass broke and you're on Medicaid, you're kind of fucked. And so I've had to think about it on my own. Now, the biggest difference between me and I'd say the vast majority of stroke patients is, number one, I believe in strength training. So I have a collection of equipment in my home, squat rack, squat cage. Sorry, I've got a little bit of itching here. We got a lot of pollen outside, and I've got the door open because it's a beautiful day. I've got a squat rack, weights, dumbbells, benches, an Airdyne Pro exercise bike, a treadmill once I get to where I'm walking again. I have the support of my wonderful lady and my sons, and I can't say that enough about my lady. She has been a lifesaver. If it wasn't for her, I don't think I would have made it. She called EMS. She's been supportive of me the entire time. She's been my own personal nurse, my own personal rock. She's my rock, is basically what I'm getting at. So what do you need to survive this shit? Well, you need drive. You need a support system, an honest, 100% support system, people who get you, people who are supporting you in terms of your emotional health, your physical health, your nutritional health. They're making sure that you do things like keep your doctor's appointments and take your pills. Now, that's one thing I've not had problems with, is taking my pills. I also do a series of supplements that I'm going to that I've been ongoing all my life. That's B complex vitamins, thiamine, and folate, as well as large doses of vitamin C and zinc, calcium, magnesium mixed in with the zinc. So kind of a combo deal. Some vitamin D is necessary. I would suggest vitamin E. Some fish oil is probably not a bad idea. I do take 5 grams of glucosamine every day because, my bones hurt. So that's a short supplement list of things. I'm going to try a few other things, some nootropics that I've ordered, should be here pretty soon. Give those a go to help me with the brain fog. So that's what's up with that, man. So again, how you recover and how you heal is entirely up to you and your support system that you have. Your physical therapists are a key part of that. Listen to them. Listen to your occupational therapists. I did have a brief bout with speech language pathology, and we talked a little bit about cognitive therapy, thinking, all that kind of stuff. I'm a bit more of allegedly, a bit more of a complex thinker than they're accustomed to. So I have a longer way to go. And so clinically, I'm out of nursing for a while. I won't be going back to work for a bit. And the struggle begins applying for disability and trying to get some help from the government, which apparently there's so many roadblocks and so many things in the way that it's difficult. So I am going to take advantage of, or try to take advantage of some resources here in Alaska Rehabilitation, help me pay for school, things like that. So we'll see how it goes. But I am a stroke survivor, and for those guys out there that ignore the signs and symptoms, I'll tell you that early on, looking back, I had some ideas that something was happening. So I'll give you an example. A couple of months ago, I was in Cabela's looking at some archery equipment and stuff because I'm a bit of a bow hunter. I'm not going to lie to you. A bit of a geek when it comes to that kind of stuff. So I was looking at some stuff and I had some numbness and tingling in this left hand. And turned my head and kind of worked it out, took some deep breaths, and it went away. Years ago, I was in a very stressful situation, and relationship-wise, work-wise, and I remember having this dizzying feeling on my couch, and I felt like I just needed to go to sleep. And so it turns out that was probably an old stroke. And so when they do a bigger dive into your brain and start looking at different imaging and things of that nature, they find little things, especially with the mRNA technologies and things of that nature. They can find little things in your brain that may have gone unnoticed over the years. And so I apparently had a stroke a number of years ago that went unnoticed because there were really no symptoms. So the brain is a remarkable organ. Take care of it. You're going to need that joker. So guys, don't ignore the signs and symptoms of stroke. Be mindful of your blood pressure, your blood sugar. I'm not a diabetic. They were checking my sugar while I was in the hospital, which was interesting to me, but I did get some rounds of steroids for the sinus infection that just wouldn't go away. Here in Alaska, the last couple of years I've gotten kind of one of those sinus infections. It just sort of lingers, and it lingers for weeks sometimes, especially post-COVID. And so it wasn't COVID. I didn't have COVID. For the record, I have been jabbed a couple of times, but probably shouldn't even mention Schmovid in this video. I'd probably get canceled. So anyway, I did get jabbed a couple of times. I don't know that was a stroke injury that I had, or injury that I had, but who knows? It could be. Lots of folks who get are having strokes and things of that nature. But for me, I think it probably had more to do with high blood pressure, using over-the-counter medications to excess, trying to cure myself and just not seeing the doctor. Okay? So get out and see your primary care physician. Get your blood pressure followed. Make sure you're taking the right medications at the right times. Getting your prescriptions filled if you can. One of the smartest things you can do, guys, is get yourself a discount card at your local pharmacy. It's worked out pretty well for me. When I got out of the hospital, I had 4 different medications that I had to have filled. And with the discount card, it's Plavix, Losartan, Lipitor, and I think hydrochlorothione or something. It's a water pill. 4 of those altogether are about $50. So you got no excuses to not take your fucking pills, and no excuses not to pick up your medications unless you're just a lazy bastard. In which case, you know, and a few months later, when that second stroke hits you and you're knocked out cold and your whole body won't move, you'll be thinking about, oh, man, maybe I should have gotten my pills. Now, the other part of this, the other piece of this is your body habits, okay? Super important. Get rid of the fat. Get rid of as much fat as possible. You shouldn't be a smoker. That just shouldn't be a thing. And alcohol, yeah, it's got to go. So you can smoke all the pot you want to if you think that's going to be helpful to you. I'm here to tell you that it's not. And anybody who's had marijuana-induced emesis knows that. Vomiting uncontrollably for days at a time when you run out of pot, or when you're smoking too much pot, vomiting. Bleh, bleh, bleh. Dude, we can't give you enough medications in the emergency room to make that stop. We can give you some fluids, pat you on the head, but if you're a 30-year-old pot smoker living in your mom's basement, and you're all up in the ER 19 times a year because, you know, you can't stop vomiting, guess what, buddy? You're smoking too much pot. So, anyway, stroke survivor, Big Rob, just a guy over 50. Hope everybody's doing well. I'm going to do more of these videos, I think, just to kind of help my own self in terms of emotional support and just kind of getting things out. So anyway, good luck to you. Talk to your doctor. Take care of your body. Take care of your family. Take care of yourself. Peace.